I believe in biology, and so I will never not be a biological female. But what I want to be is a man. I do not believe trans women are women. I believe trans women are trans women. There's a difference between knowing what it means to be a woman and wanting to be a woman. This might make some trans people mad, but you know me, I don't care. This is a costume, dude. I'm walking around in a costume. I don't think it's fair that trans women who are biological males, who were socialized as males, can come into that space and act as if they know what it means to be a woman, because they do not. And they call me transphobic, which is absurd.
That was one of the absurdities that stuck out to me, like something weird is going on here. Ladies and gentlemen, the following is a conversation with Buck Angel. Buck identifies himself as female who lives as a man, a transsexual as opposed to transgender, an important distinction in his eyes and increasingly in mine. For me, seeing Buck online for the first time was a major red pill, mind-opening moment, and I hope it will be for some of you as well, because here was what seemed to be a very down-to-earth and reasonable trans-identifying person who was openly questioning and in certain cases quite strongly opposing the politically correct Pride or LGBTQIA plus belief set, particularly so when it comes to transitioning kids. And his questioning, his voice of dissent, alongside that of Blair White, another public transsexual of whom I am a fan, in a very real way paved the path for mine. It got me thinking deeply. It got me thinking about which parts of the Pride movement I'm actually for and supportive of, and which parts I'm actually not. And so hopefully today's conversation will help open your mind in a similar way when it comes to Pride. Hopefully it'll have you thinking more deeply about what are you actually supportive of, and when you think about it, what are you not? Now, before we kick off our conversation, when connecting with Buck initially online for this podcast, I outlined the goal with the following statement. How we think about, how we talk about, and how we define gender has a number of very real implications for the way that we live our lives and the way that we structure our society together. But unfortunately, it seems that we are a confused and divided people on a number of gender-related issues at the moment, be it sports, be it safe spaces, be it the treating of gender dysphoria, especially so in young children. Now, my hope in speaking with Buck today is that we can do our part in fixing that division via dialogue. The first goal of the conversation is to understand. What do we believe and why? And then secondly, even if we disagree on this point or on that point, we can come together in pursuit of truth, reason, and the good to try and find common ground. So with that as the container for this conversation and the CGC podcast more generally, with that same spirit, it is my great pleasure that I introduce to you Buck Angel. Welcome to the CGC podcast, Buck. It's an absolute pleasure to be speaking with you today.
Oh, thank you, Frank. Wow, that was a great introduction, by the way. But no, it's super awesome. I really always appreciate people asking me to come on. Even we might have different opinions, but I see what you're doing here. You're building bridges, which is what I do. And I think this is the way we're going to get into a better space.
Absolutely. And look, honestly, that's actually one of the questions that I wanted to ask you today is when we are engaging in these types of contentious gender-related questions, how do we bridge the gap? So I might actually leave that question for a bit later in the conversation. I do want to open first just with, you know, for those who aren't familiar with you or your work, could you please give us some insight into who is Buck Angel? What's your story? And also, why do you think gender has become such a contentious topic as of late?
So, yes, my name is Buck Angel. I'm a 60-year-old transsexual man. I'm a biological female who transitioned to live my life as a male 30 years ago. So I started my work in pornography, and that was about 21 years ago. Prior to that, I wasn't really sort of out doing activism. I hate even using that word now, but, you know, I think in my transition, I really became much more of an activist, talking about my transition and why it's important for people like me, and that transsexualism is an actual real disorder. And I traveled the world doing that prior to, I think, what you see today. But so really, I very much acknowledge my biology. I very much speak out about how important biology is in this equation. And as you see, on some level, I'm going against the actual narrative of the transgender rights activism these days because it does not align with who I am or why I transitioned or what I believe transition is about. So really that's where my voice lies today. But I would say the most important part of my work right now is children. And what I mean by that is that I'm 100% opposed to transitioning children. And I do not believe that we are in a space to do that. And I do not believe in trans kids. I believe kids have dysphoria or kids have some sort of things going on mentally that they need to deal with, but I do not believe we should be calling them trans kids. So I think that's probably one of the most important platforms I speak out on today.
And look, that's a great primer for anyone who's watching. I think that a lot of the interviews that you're conducting on your YouTube at the moment, in giving a voice to people who are transgender or who identify as or who are transsexual, I'm not quite sure the right language there, and also speaking out openly against the parts of that I suppose you could call it a narrative that you don't agree with. What just to kind of perhaps outline a couple of rabbit holes for us to go down, what would you say are the key or the major disagreements that you have, perhaps beyond trans kids, with the politically correct belief set that kind of goes along with LGBTQIA+?
Well, first off, I hate putting it as LGBTQIA+, because we're talking about trans. We're not talking about gays, lesbians, bisexuals, queer. This is a conversation that has to do with trans. So for me, whenever everything is always lumped into LGBTQIA pee poo poo, and I don't believe that because that's where it's gone, my friend. So literally every day you got to check on the internet to see what letter has been added.
What's been added.
It's ridiculous. But so you remember, I'm old school. So you're talking to a 60-year-old transsexual who transitioned 30 years ago. I've been in this community for maybe because I lived as a gay woman prior to my transition. But that being said, so what I really want to say here is I don't like that it's LGBTQIA+, because it's not. This is a conversation that has to do with transgender and non-binary and even queer. Those three people, those three sort of identities have taken over the narrative of the community in a sense. So one of the things I disagree with is that they say you don't need gender dysphoria to be trans. Well, that is ridiculous. That's like saying you don't have to be black, or you don't need diabetes to have diabetes. Like, it just doesn't resonate with me, because I do have a disorder called gender dysphoria, and I very much embraced that disorder for me to be able to move. It's like any disorder, right? Or any kind of sort of diagnosis. It helps you sort of settle down and realize, oh, why was I not
sense of
feeling
things.
That's right. I wasn't feeling comfortable in the world as a woman, and it just didn't make me feel comfortable. So that's
but could you just quickly give people a sense of how you would define gender dysphoria? Because I know that that it was previously classified as a mental illness, I believe, or mental disorder. And now some people are saying that it's not. And I actually recently watched a podcast or a conversation between you were with Amala from PragerU,
yes.
and you were speaking with another transgender person, and you were having the discussion about gender dysphoria. Is it a mental illness or not? Can you give us a bit of a briefing on that?
Sure. So I do claim to have a mental disorder, which is called gender dysphoria. And what that means is that sort of my outside doesn't fit the way I feel on the inside, if that makes sense. I'm trying to make it as pretty sort of layman as possible, in that fact that people can sort of understand who don't have it. I just always wanted to be a boy. I always felt like a boy. I always felt like I felt comfortable walking the world masculine. So that's really what gender dysphoria is. I had a lot of anxiety, a lot of depression. I was a drug addict. I was an alcoholic. I was homeless. I was a crack addict. I was everything you could imagine, homeless, because I was not comfortable. It wasn't until I transitioned and really look how I look today that, my parents are like, who are you? Because I was just not the guy you see today. I was very withdrawn, hateful, cutting myself. And not to say that everybody with gender dysphoria is like that, but, you have to remember when I transitioned and we didn't have the internet or these things. So I want people to understand it's a missing space of how you feel on the inside, and it's not being reflected on the outside. So people like myself who are transsexual, That's all it is. It's real simple. We just need to change our outside in order to feel comfortable to walk the world. That's why we don't resonate with this transgender agenda, because we believe in the binary. I want to be a man. I don't want to be a woman, right? So I make myself look like a man, and then I walk the world that way. I walk the world as a man. I changed all my identification. If I wasn't a public figure, then nobody would ever know when I walk down the street, right? And so that's the point, is we don't want people to know we are trans.
And I can see how, and it looks something I'd like to get into a little bit later, as well as some of those internal contradictions within the LGBTQIA plus, etc.
Right.
And I also noticed that in your Twitter bio, you have gay rights as well.
Gay
so
rights.
I'd love to kind of touch on that too. Like a lot of these ideas or contradictions, or where I previously have just kind of grouped it all in together. You and listening to people like you, like Blair, have kind of helped clarify some categories for me. So gender, you put your finger on gender dysphoria as one key area that you kind of disagree with the politically correct belief set. What are some other ones beyond as well trans kids?
Oh, for trans kids, so what I said earlier is, first of all, I don't really believe there are trans kids. I believe these are kids who are dealing with some type of thing. Now, today we also have the social media, and I'm a big believer of social contagion. And you can just say that with anything. I mean, kids have always been that way. I mean, I have a kid. He follows the leader, right? It's a very normal thing that a child can do. But what's happening is I think we're targeting a lot of kids who have some other disorders going on, and we're not addressing those disorders, because here's what I disagree with. It's called self-ID. And it's called affirmative therapy. So you're not getting any pushback. If you right there, my friend Richard, said, I'm trans, nobody could push back on you. Nobody could give you therapy to say, hey, wait a minute here, dude. What does that mean? So when I went to therapy, my therapist said, well, what does that mean you're a dude? And we had to walk the world as masculine people before we could even have surgery, and it's called what I like to call a buffer, right? So you're just kind of feeling it out to make sure before I take medication and before I do anything, excuse me, that's irreversible, like this is irreversible, that you make that you have that safe space there to make that choice. We're not even doing that anymore. We're just straight up going into drugs, surgery, you're trans, affirming that and now we have a bunch of detransitioners. And so that's how I know something's wrong, because we have all these kids backing out of it when they said they were trans. They were all so adamant to be trans, and now they're all backing out of it.
And this is also a really important part of your role in this space as well, as far as I see it, is giving a voice to some of those detransitioners.
Thank you.
We've spoken to some people, and we've had some critics on our TikTok before it got deleted from the internet.
It did?
Yeah,
you lost your TikTok?
Our first account. Yeah, 230K followers or something.
God, I'm sorry.
But, no. Well, I mean, we have to play the game of strategy here. But we had some critics saying that if you are a detransitioner, you should not speak on trans issues because you weren't really trans in the first place. And I know. So, and look, I think where I can find common ground with virtually everyone I speak with is if there is a young person in front of us who is confused about how they want to be seen, they're confused about their identity, which, by the way, I think is a combination of not only how you self-identify, but it's also how you're socially defined and how you interact with people. If they're confused about that, how do we best, and say specifically with respect to gender, how do we best support a young person like that? And I think that's where this false kind of dichotomy is set up, where you either support and gender affirm and say, yes, you are whatever you say you are, or you're a bad person, which I don't think is the case, right? I think plenty of parents, I mean, every parent wants the best for their kid. They may not necessarily just agree with the gender affirming model. So we look, I really look forward to having some conversations with people who do believe in the gender affirming model and teasing it apart, because I'm sure they have some reasoning for what they're doing and why they believe that. But I think this would be a great place to, I roughly had an idea of, I'd like to clarify some of the language and some of the terminology surrounding gender, because I think that's a big point of confusion where, when people are trying to build bridges, it's very difficult to build a bridge unless we have a shared understanding of the language. So, you know, one person might say man, the other person might say man, and they mean different things. Same goes for women, same goes for trans, etc. So I'd love to, break down the language and get clear on that, and then see if we can take that shared language and then pull it into the implications, and we can look at gender dysphoria in kids and perhaps some of those other implications as well. So if I were to ask you, Buck, what is gender? How would you define it?
Well, you know, I'm the guy who comes from, I believe sex and gender are the same thing. So I think you're born in your gender and your sex. And so I think that you can also identify out of the gender that you were born in. But I think this is the distinction for me, is that I believe in biology. And so I will never not be a biological female. But what I want to be is a man. So I make this way of being to look like a man. I've chosen to do this. So on some level, I've chosen this identity to reflect how I feel, though it's not how I was born. But I think today people are trying to separate gender from biological sex. And for example, using the AFAB, right? Assigned female at birth. I disagree with. I was not assigned anything. I am an actual real biological female. So for me, it's the
assigned or observed.
And I don't believe that. I believe that I actually am a female, because I am. And so it's important. It is very important that I think people out there hear what I'm saying, because we're being told that that's not true, which I think is part of the language barrier here. And I think it's why sometimes I actually confuse some people, because but wait a minute, I'm hearing from the community that, you know, there's no such thing as a biological female. And I'm like, but that's not true. So what's happening is I'm fighting against, I believe, an ideology on some level to try to disrupt what trans really is. Okay,
so this was another question that I wanted to ask you today was, how, when we, because I hear this term a lot, the gender ideology.
Yes.
And what exactly does that mean when you use it the way you do?
Yeah.
How's it different to just like a set of ideas?
An idea. So it's an agenda. I don't have an agenda. I never have. I have a medical condition. A medical condition is not an agenda, right? I'm not trying to pull people into this. And in fact, I try to push people away from it. It is not a great way to live. And I made the choice at 30. So that being said, I don't think a 16-year-old can actually make that choice. Yet they think a 16-year-old, and they're like, come, it'll change your life. It's beautiful. Right. It's amazing. That's, to me, an ideology. And the other part of that ideology is when you leave the trans community, you are shunned and you are pushed away, where I don't do that. If you leave, I actually give you a lot of love and respect and try to find out why you left. So I don't have, you see, that's to me as an ideology, because you're just so set in this one way of thinking on some level. So one I've heard ideology also used in a way to describe a set of ideas, but in particular, a set of ideas or beliefs that are almost religious. They're kind of somewhat religious in the sense that they provide us with a moral framework. And I think that there's another rabbit hole here with respect to, in the wake of religion, do we leave ourselves susceptible to oversimplistic ideologies in the search for a purpose or a fight or a cause? And I think a lot of people are looking for the good fight. And when they get given this perhaps an oversimplistic moral framework to adopt, that they're more susceptible to taking it on. So right. I suppose what I would love to then go back to is that, and this might actually be a point where we may disagree. I'm not sure this will be interesting, but I tend to separate gender and sex. When people ask me, is gender a binary or a spectrum, I tend to say that it's a spectrum, but that's because when it comes to, it comes with a little asterisk. So gender, I think it's used to mean a lot of different things in a lot of different ways. And I'll always say, okay, let's get more precise with our language. So sex, I do think that biological sex is important. It's important that we keep that distinction between biological male and biological female. And increasingly, there are companies like Google and Facebook where when you sign up, they'll say, what's your gender? But then they'll say male and female. And that's very confusing, because that terminology, male and female, is typically, or was traditionally used for sex. So now I use that qualifier of like biological female or biological male. So that's sex, XX chromosomes or XY chromosomes.
And then there's a small minority who don't fit neatly into that binary, and we might refer to them as intersex, and that's right, another kettle of fish. But that would be the sex layer. And then the gender layer, that's where I typically try and break it down into gender identity, gender expression, and also gender stereotypes or expectations. So you mentioned before that, you felt as though you had this internal sense of, I don't want to put words in your mouth here. I want to be a man, or I am a man?
I want to be.
Okay.
So even today, I know that I'm not a man. I know 100% I'm a biological female who wants to be a man. That's why I put in my bio, female who lives as male. Because it's important that people understand that I am not, and that's because I fight for women's rights as well. I do not believe trans women are women. I believe trans women are trans women. So also there's a distinction between man and male. So I know that I'm not male, but I live as a man. So even those words mean, so you say biological female. Most people don't say biological woman. They say biological female. So I'm a biological female who's not male, but wants to live as a man. I try to make it as simple as possible.
Right. Okay. So I'm with you at that point then. So would we then, if you don't say that you are a biological male, but you say that you're living as a man, would it be right to think that then that term man, because that's also something I like to get clear on, the term woman and man, is man then it's a social identity of sorts? Where,
I think it's a descriptor. I think it's a descriptor, if that makes sense, right? So like a descriptor would be, I'm a transsexual man, you are a biological man. So we're different. We both live male, but you were born male and I am living as a male. So I don't think I'm the same as you.
Okay. That's where I think that the terminology gets a little tricky with male, because some people use it to be for chromosomes, whereas some people use it for like the living as. And then I think that can also give rise to the, assigned female at birth or assigned male at birth.
Right.
So that's why now I tend to stick with biological female or biological male and using that terminology. So if we then separate it, would it be correct in then saying, like, let's say that gender identity is your subjective sense of who you are or who you might want to be? Would that be where your gender identity would be man?
Yes, that's exactly right. Not male,
and I would
man.
Yeah. Let's say your gender expression would also be man, in the sense that you present as a man. Most people would consider you to be a man, or at least in passing or seeing you out and interacting with you. Now, what I'm curious about as well, and this ties into the I suppose the non-binary side of things and the gender dysphoria side of things, where when people say that they feel more like a man, or they feel like they ought to be a man or a woman, is that not based on people's sex stereotypes?
Yes, 100%. Look at me.
Okay.
It's literally I'm such a stereotype, dude. I'm like the stereotype. 100%. And I this might make some trans people mad, but me, I don't care. This is a costume, dude. I'm walking around in a costume. I'm not trying to fool anybody, to be honest with you. It's why I'm always so honest about who and what I am. I'm trying to make my life comfortable. And it is 100% more comfortable for me to walk the world looking like this dude than if you Google me, you'll see pictures of me when I was a female model. You know what I mean? So I was a woman. And so it wasn't comfortable.
Buck, why is that? Why is that you feel more comfortable living as and presenting in a more masculine or male typical way, as opposed to being, because you mentioned that you lived as a gay woman for quite some time. So what made you go this path?
Well, I'll tell you, it's really fascinating. it's literally the way people look at me and the way people interact with me as I walk the world. So even though inside I always felt like I looked like this when I didn't look anything like this. And so you'd walk down the street and people would see a woman and it would just make me go crazy. And I would constantly not be able to look at anybody. That's the dysphoria. That is the actual dysphoria. It didn't help me walk the world. It didn't help me become a successful business person. It didn't help me want to live. It didn't help me want to be part of a family. It didn't make me want to have a wife or kids. It made me want to actually just crawl up in a ball and hide. And so that's why when people see me now, they're like, wow, dude, that's incredible. Like, I can't believe I just became a person, and I took my hat off and I opened my eyes and I embraced the world. So it's really about the way the world sees me. It made me comfortable to walk the world. That's why I did it, for no other reason than to be able to walk the world happy and coexist. I really think people need to understand, I don't want to be separate from you, and I don't want to have, take over your space. I want to be with you. I want to hang out. I want to walk the world, if that makes sense. I don't feel like I don't need anything more from you. I just need for you to say, okay, cool, Buck's a dude. Let's move forward.
Yeah. Well, and we'll definitely get onto that the sharing of spaces and whatnot just a tad later.
Yeah.
So if we go one layer deeper, Buck, when it comes to that gender dysphoria, and I mean, you've got a plethora of experience of speaking to trans people as well. Mm-hmm. What are the causes of that gender dysphoria? So because I suppose I'm trying to understand. Maybe not everyone with gender dysphoria ought to be treated or have the same supposed treatment pathway.
That's right.
There are different.
Yep.
There might be different root causes that require different solutions. So I'd love for you to kind of lay that out from your experience. What are the root causes of gender dysphoria, and also for you, where do you think that sense of being more comfortable as a man as opposed to a woman came from?
Well, I'm going to tell you, I do believe you're born with gender dysphoria because, I can tell you that I've felt like this my whole life. It was never something that just happened. When I was a little kid, my parents let me be little Buck, and that's me from like the age 4, right? My mom always told me I always wanted to wear cowboy boots and be a cowboy and, be Buck and do all those things and have the boy name. And so it was so how I know is because I lived as a woman for many years of my life. And this is why I believe these kids need to live a little bit through they have to most definitely go through their puberty, and they have to live life a little. Even if it's uncomfortable, they have to, because you are not living enough, you don't have enough life experience to understand, I'm going to be more comfortable in the world living as a man. Because what you just said is a very important part of that. Not everybody with gender dysphoria needs to actually change. Somehow they need to come into understanding, why do I have this dysphoria and why am I so uncomfortable walking the world? Some people can work through that and never have to do what I do, ever. But some people have to do what I do. But you have to, again, understand, that's the difference between a transsexual person and a transgender. Transgender people today identify as trans. I do not identify as trans. I identify as a male, remember? So you see the difference?
Right, I got you. Okay, so this is where it starts to get a little bit tricky, because if, I'm trying to ask myself the question, is there an instance where I'm supportive of, say, a young person transitioning? Now, I know that you're not, but I wonder whether, hypothetically, right, let's say if we could rewind the clock and we were able to speak or help young Buck pre-transition, pre-puberty as well, pre-female puberty. If you knew what you knew now, and hypothetically, if there were tests that we could give a young person where we could determine whether or not they would desist in their gender dysphoria, or whether it would persist and they would be someone like yourself, would it, and now hypothetically, if we had that test, would it not then be a good idea to give those kids the option of transitioning?
Well, yeah.
You see what I mean?
In a beautiful, amazing, perfect world, most definitely, I think so. But I'm going to say this. It's not. That stuff is not okay. What they're giving kids, and if they knew how to do it without all the insane side effects, first off, there's that. So there's a lot of very negative side effects that a 10-year-old cannot choose to have. One being, sterility or sexual function. That's 100% true that they will lose that through the blockage with puberty blockers. That's an actual fact. And so that being said, I don't think a 10-year-old can make that choice, because when they become 20 and they're now sterile, whose fault is that? So with that, if it was none of the side effects and we showed lots of work in data that showed that it was, which we have data that shows it doesn't work, and it's why everybody's pulling back on it, then yeah. But I'm going to tell you that I get this question all the time. Would you have chosen to transition as a kid? I probably would have, but I'll tell you what, my parents would have never done it, and thank God they wouldn't, because I keep telling people all of that life experience I had made me this guy I am today. Yeah, I struggle, no doubt about it, but I'm a believer of struggle on some level. I feel like we're trying to wipe out struggle, which is completely ridiculous. You have to fall. My kid falls down all the time. I'm like, dude, get up. Let's go, dude.
Yeah, 100%. Look, I honestly think that you're actually, I think you're tapping into almost a spirit at the base of our society with respect to we so badly want to protect and include that we actually infantilize to a degree. But with just to make sure that I've understood your perspective, Buck, is it then that people kind of need a degree of experience living in gender that aligns with their sex to properly, I suppose, make a decision about what's the right pathway? Is it actually biologically attempting to transition such that you appear more like the opposite sex?
Yeah. So
along those lines, okay.
Do we really think a 10-year-old can make that choice? Come on. Do we even think a 15-year-old?
Yeah, it's a question of consent.
That's right. And they always say these kids consented. I go, no, they didn't. They didn't understand. Listen to all the detransitioners. None of them got what I got. What I got was completely different what they got. Have I turned around? No. 30 plus years in this space and keep going. You know what I mean? I have never looked back. It's been the most amazing thing I ever did for my life. I'll be honest with you. That being said, besides my kid, but that being said, I just refuse to believe a 15-year-old. Now, there are some. I've met some young 15, 16-year-olds who seem very adjusted after 2 or 3 years of this. But how are they going to feel in 10 years? And do we care how they're going to feel? And is it actually life-threatening? Is it? Do we actually really know that? Or is that one of those sort of mantras that they keep putting out in the trans community to scare everybody or to make people think they have to do it?
And I think this is one of those, again, those false dichotomies of, do you want a trans kid or do you want a dead kid? And when a parent who hasn't thought about it all that much and is put in a position like that, of course you're going to say, well, I want my kid to remain alive. I think also another issue here is the presentation of some of the depression, anxiety, suicide attempts and suicides more generally for trans identifying people. It gets presented as though it is a consequence of their improper treatment by the rest of society that leads to these poor outcomes, as opposed to it being a comorbidity. So for example, with something like anorexia, or if we take the population of anorexic girls, if they have higher rates of anxiety and depression and suicide attempts or self-harm or even trauma, some kind of sexual trauma or something to that effect, we don't assume that those stats or those poor outcomes, I suppose, are a consequence of the anorexia. We understand that it's a complex kind of interrelated set of phenomena, and I think the same kind of thinking needs to be applied to young trans people. Where is this gender dysphoria coming from? If they have anxiety, depression, some kind of sexual trauma as well, it's not self-evident that it's a causation from the transgender side of things. It may well be just a correlation that needs to be further unpacked.
But they're not unpacking that, and that's where I want to talk about affirmative therapy, which is you just affirm. You know, you're not allowed to say, hold up here, wait a minute, is there something going on? What happened here? A lot of these kids do have sexual trauma. They all have said it, or BPD, or, you know, autism, or all these things that now are supposedly related to being trans, when I disagree. These are things that are not trans. There's something else going on with these people. When I transitioned, you had to go to years of therapy so they could talk to you about and figure out, do they really need to transition, or is something else going on with this kid that we could, you know, sort of move forward. But they're not doing that, my friend. 20-minute intakes. You cannot diagnose somebody in 20 minutes. That's actually impossible.
Yeah, and this is look, my girlfriend's studying psychology, and I've also listened to a number of clinicians like Jordan Peterson speak about this, how if you have a gender confused person, a young person, come to you and say that they don't know whether they're a boy or a girl, and the notion that you have to say you are what you say you are, as opposed, which is actually the opposite of the role of a therapist, which is to unpack and help you understand. That is a major concern, and it's also a major concern that the governing bodies are now enforcing or holding clinicians accountable to this gender affirming model. And that's not to say that you can be supportive of some kids transitioning, but you don't have to assume that the child knows who they are. And I think this is where it comes back to what we were talking about before with respect to identity, that identity is not just self-defined, it's also socially defined and mediated. You kind of negotiate your identity with people. And the idea that a young kid knows who they are and that there's some kind of authentic self that society corrupts or covers up over time, and that fundamentally the young person is the truest source of that identity or who I am, to me that seems like a borderline it's a borderline religious idea with respect to like a gendered soul. And again, I wonder how much of this is coming from our desperation for a sense of meaning. There are some people who want to have something worth fighting for, and I wonder whether young gender confused kids are getting pulled into that desperate search for a meaning, and they are unfortunately becoming like a sacrificial
lamb.
Well, a pawn.
No, you said it. That's exactly what's happening. I mean, you just hit it on the nose, my friend. Come on, man. We all wanted to be part of something when we were 16. We all wanted to be in a group, you know, especially kids who are that, which I was one of those. So I was a punk rocker, a hardcore, you know, skinhead girl punk rocker. So, you know, we're always looking, especially kids like me who are shy, withdrawn, have some things going on. We find you always find your tribe. So talking to detransitioners, I hear a lot of them said their peers pressured them to transition. They get a lot of pressure, peer pressure.
Which is the social contagion side of things as well. I read Irreversible Damage by Abigail Shrier, which is also a very eye-opening book with respect to you can want to support a gender-confused young person. You don't necessarily have to say that gender-affirming care is the best model. So these are the kinds of conversations I want to tease out and have people thinking about. Now, I'm conscious of time here, and I do want to kind of take some of that language or terminology that we've clarified a little bit and pull that into the implications of the language. So we've kind of touched a little bit on the on trans kids or the notion of trans kids. I'm curious to hear what your position is with respect to safe spaces. So if we take something like bathrooms or change rooms, should we separate based on self-ID'd gender? Or should we separate based on sex, and why?
Are you talking about youth? Or are you talking about adults? Because those are two different things I'm going to have different answers for. So,
interesting. Okay.
Right? Of course, because
I'd love to hear both. Yeah.
I have a kid, right? So I have a kid who's a boy, right? And he's getting to be that age where he's crushing on girls, right? So let's say there's a girl.
How old is he, Buck? How old is
10. He's 10.
10, okay.
And I think it's getting to be that puberty stage.
Yep.
So
Yep.
I'm just like, it's hilarious to me. But anyways, because he gets all red in the face. I know he has a crush on one of the girls at school because he gets red in the face. It's so cute. But anyway, so imagine just if like he knew Susie at school and all of a sudden Susie comes back the next year and Susie's now Tommy. And now Tommy's using the same toilet as my son. He's going to be a little uncomfortable about that. And I don't think he's actually going to be okay with it. If the kid didn't transition in the school and he didn't know them, no worries. Nobody would ever know. But you see, it's not so black and white that everybody keeps trying to make it, right? These kids, trans kids are rare. There's not a lot of them. That seems to be like there's more and more, which is making me alarmed because this is a very small disorder, my friend. It's not what they're trying to make it seem like. I did 30 years ago.
Yeah.
Don't you think there'd be more of us? If I did it 30 years ago, how come all of a sudden in the last 5 years it's exploded? So I have that issue because I'm kids are finding their space around sex and around their gender, and it's uncomfortable for boys to be around girls and girls to be around boys during that time. So there's that. So I think that's a kind of nuanced space. Now, with regards to female space, okay, because this doesn't have anything to do with male space. I'll be honest with you. Men don't care about me. I can use the men's room, the locker room. No one's ever complained about me. I've been naked in there. No one's ever said a word to me about anything. I think this is a conversation.
I think it is very different. It's good that you've put your finger on that because that was something I was going to bring up. I think it's different. There is an important distinction between a trans man or a biological female who presents as a man using the men's bathroom and a biological male presenting or self-identifying as woman and then using the women's change rooms or bathrooms with biological females. So I'd love to hear your take.
Well,
on
so take that. If the transgender woman is like Blair White, okay, let's use Blair White. No one cares. Not one woman would say a word to her. Believe me, she does it all the time. I hang out with her. She goes in the women's room, she does her thing, walks out. It's all good. But we have these different kind of trans women today who are not willing to do that type of work, which we call passing, right? This is passing. So they don't do that. They still have beards and maybe they put a dress on or maybe they don't look like women. And so those are the ones really that I think most people have an issue with and they don't feel comfortable with them coming in. And I don't even feel comfortable with them. I don't think it's fair. You've never been a woman, my friend. I have. It is an actually very different place to walk the world. It is. It is nowhere near being a dude. I have such a different way of being now. And when you're a woman, it is a little more, I don't want to use scary, but you have to constantly be aware of your surroundings. It is a real thing. Yeah. And it's just the way people treat you, the way the world treats you is different, my friend. And I don't think it's fair that trans women who are biological males, who are socialized as males, can come into that space and act as if they know what it means to be a woman, because they do not. There's a difference between knowing what it means to be a woman and wanting to be a woman, right? I don't know what it means to be a man. I have no idea, dude. I'm winging this. I'm totally winging it right now, dude.
I love that. I think to speak to that point, Buck, I've got a mother that I'm very close with, and I've got two younger sisters and also a girlfriend that I'm extremely close to. And I think having these very intimate relationships with biological females has instilled a deep sense of empathy and understanding with respect to some of the vulnerabilities of being a biological female.
That's right.
And that means that I'm and it hasn't always been the case, right? Like when I was much younger, all I'm concerned with is my experience and, there's no danger there, or, I'm used to being able to walk down a street at night in the dark and not have any issues. But then in spending more time and being closer with people for whom that is not the case, there's definitely some concerns with respect to safe spaces, and how do we provide those safe spaces and when they're appropriate. So if, let's say, for example, because I've also heard Blair, I think it might have actually been in some kind of conversation with you that I heard Blair talking about this, maybe on the No Jumper podcast, with respect to when is it appropriate for a biological male to use the women's change rooms or to use the women's bathrooms. And I think there might even be a distinction there between bathrooms and change rooms, but let's just stick with bathrooms for the moment. Okay. With Blair, that's where my understanding is that even though she may not have had this surgery or that surgery, she certainly presents as a biological female or presents in a biological female typical manner and passes. Now, is that where you would draw the line as a qualifier? So you have to pass in order to be able to use, say for example, a biological male to use.
You have to make an effort.
Women's?
You have to make an effort, my friend. These people aren't making an effort. So it's not fair to people like us who actually do make an effort and really do try to coexist with you. We don't want to scare you. Blair White doesn't want to scare you. She just wants to pee. You know what I mean? But these people, they come to it with a different attitude. I don't know if you noticed that. They come to it with an attitude of, give it to me. It's mine. That's not how you come to anything.
Entitlement, I would call it.
That's right. You cannot do that. They are not entitled to use the women's room, and actually they need to be invited into the women's room. And so Blair's invited. Why is Blair invited? Why do you think Blair's invited to a women's room and no one cares that she uses the women's room?
I imagine it's partly her attitude of
that's right.
I'm not entitled, but also to the degree to which she's demonstrated
that's right.
I have a psychological issue and I'm going to this length to ameliorate that issue. As opposed to if I say I am a woman, I deserve to be able to use this space.
That's not true because you could say that right now. You could actually say that. You could say, I'm a woman and I'm entitled to use the women's room. That's how absurd it is. And I'm not going to let these people gaslight me. They're gaslighting me. I'm an old transsexual. You can't say that to me. That's not what we've done ever. We've never done that. Those are different kinds of people. They used to be considered cross-dressers or transvestites or, they weren't, those aren't transgender people or transsexual people. Those are people now who feel entitled to say they are a woman because they feel like a woman. But listen, women's space has always been fought for. It's still being fought for. And now we're going to let biological men who think they're women, again, go right ahead, dude. Make yourself a woman. I'm all for that. But understand what that means. And when you're starting to step into that space, also what that means. And you're not entitled to the space. You have to be welcomed. That's why I'm welcomed. I'm welcomed into every male space, dude. Nobody ever has an issue with me because I say, if you're not cool, I always say that. If you're not cool, I'll leave. Always. And that's up to me to sort of break that down because I believe
that's the attitude that we were just talking about. Yeah. I might also just take the opportunity as well to mention, Buck, in one of the things that I loved and have loved most about watching your content is just your demeanor and how down to earth and open to conversation you are. It's like the old the uncle, the friendly uncle that you have at the dinner table.
Well, my nickname is Trampaw, and Blair thinks of me as her dad. I'm her dad, so it's like you hit it on the head, dude. Again, I'm older. I've been around the block many times, and back again. And this is what I want people to see. We just want to hang out. We don't, this is real transsexualism here. We don't want to take over. We don't want you to hate us. We don't, we're having to clean up a huge mess, my friend. And, for 30 years of my life, I had an amazing life. And it's only been in the last 5 years that it's been insane. I've never had to say I'm a biological female more than I've had in the last 5 years. It's like insane. This brings me to 2 points. And then I think that might be a good place to begin wrapping up. But one of the points that you mentioned was that, that sense of I'm entitled to use this change room or that change room. I wonder whether that has a tie-in with what we were talking about before with respect to if people are bereft of meaning, say in the wake of a religious moral framework, they leave themselves susceptible to an ideology that gives them that sense of right, wrong, enemy, good person, and I'm the good person and the enemy's over there. And I think that it can also lead to this coddling or infantilization of young people. That's right.
And I think that can breed, we can actually be breeding narcissists, people who they just don't have the empathy to consider other people's perspectives sufficiently. and breeding narcissism, antisocial behavior, and also this sense of entitlement or victimhood. And I think also that we're incentivizing in many ways self-identifying as a victim, and that was also a very nice experience listening to people like yourself and Blair, where first of all, the transsexual being distinct from transgender, but also the transsexual identity not being I am a victim and I have been unfairly treated or something to that effect. Very much, I'm my own person. I'm gonna make things happen in this world. Yep. And by the way, I happen to have this mental disorder or mental issue, and this is how I'm going about it. One question I wanted to ask you, Buck, was, I know that if I were in your position, if I really try and think about it, it would be bothering me that the transsexual, or I suppose my people, the transsexual cohort, maybe getting swept up in some of the transgenderism activism. Does that ever bother you? And how do we best distinguish or what do we do from here, I suppose?
Well, it's a great question, and it's why people like Blair and me and many other of us are separating ourselves by saying we're not transgender, we're transsexual. And then people like you bring us on your show, and we get to tell the world, oh, those people are not like us. We're completely different people. So people are starting to hear us and see, they're like, oh, transgender is an umbrella. Remember that. It's an umbrella term for everything gender identity. Non-binary is not trans. That's a choice. I did not choose. See, that I didn't choose this. If I could have made a choice, dude, I would have been you. But I didn't choose to be trans. These people are choosing it. That's what that self-ID is. You see the difference? I didn't choose gender dysphoria. They don't even have. I suppose
I know some people would say that they don't choose it, but I do understand the distinction there between. Like we met and interviewed a person called Leah who identified as a trans woman and said that the pronouns were she and they, and it was trans woman / non-binary, and that's where again it gets it. That's I think that's quite distinct from someone like yourself or Blair.
That's right. So you see what they're doing there? And so that's when I said, no, I don't have anything to do with that. I am completely binary. I want to be a man. I have a thing called gender dysphoria. I live in the binary. I believe in biology. We're just two separate things. What I believe, they don't even believe. And they call me transphobic, which is absurd. I'm older
that was one of the absurdities that stuck out to me. Like, something weird is going on here. And
something a little weird here, dude.
Yeah, something's off. But then that's I had the reaction that you just did before, where I was like, oh, okay, now I get it. Here's the distinction. And I also think that there's this religious drive for inclusion to infinity and beyond, which unfortunately is resulting in the collapsing of categories where you can't say in a politically correct manner that we're actually different. We're different. And another fascinating conversation that I watched. It was Blair with on Vice, and she was speaking about the queerness and non-binary, and that was also another fascinating. Oh, okay, like there's all these different voices. But unfortunately, we get told. So we went, just to give you some quick context before we wrap up here. I went to an event. It was the Midsummer Parade in Melbourne, which was it's a pride festival essentially.
Yep.
And we went with the question, "What is gender?" Or two genders agree or disagree. Tell us what you believe and why. And this girl came up to me and essentially said, "Are you here to celebrate Pride?" And the implication afterwards was, if you're not here to celebrate Pride, or she said this, if you're not here to celebrate Pride, then just F off. Wow. And it got me thinking, what exactly is Pride? And this is where it gets reflected in that LGBTQIA plus. What exactly is the plus? What's going on here? And I feel like it's just inclusion. The collapsing of categories and distinctions like you've drawn there between transgender and transsexual.
That's right.
And then also, I'm also very conscious of all movements are susceptible to hijack. To hijack by people who are just looking to say, I'm the good person and the villain or evil is located in someone else. And so, and I suppose one step further, I'm also conscious that a confused and fearful people comply. So if you want compliance, that's the recipe. Get people scared to engage in conversation or say what they believe, and that via social punishment or actual real punishment, say in the corporate world, and then also confuse them to no end with changing definitions and language. So, Buck, I think that's an awesome place to wrap up here. I would like to, before we say our goodbyes, where can people find you online? And is there anything in particular that you'd like to direct them to, whether it's a podcast or some interviews that you're running or whatnot?
Oh, first off, thanks so much. I really appreciate you having the open conversation that a lot of people are too scared to have. So it really means a lot to me that you're willing to, sort of break this down so that we can start to get back to some form of normality, because it's really, it is crashing, and it's very detrimental, not only to me, but to you. And so with that, everyone can find me on Twitter, Buck Angel, Instagram, Buck Angel. I have a YouTube channel called Buck Angel Official, where you can see all my interviews with people. And I'm like literally all over the internet. I'm doing so many podcasts. No, because people like you are willing to have the conversation. You know that. This is what we need, conversation. And, those people don't want us to have it, because I really believe what you just said in the closing right there was so powerful, what you said, because that's exactly what's happening. They're trying to stop us from. And so for me, when I think people want to stop us from speaking, my red flag goes up. I'm like, something bad's happening here.
My gut says the exact same thing.
Yep.
I'm totally open to disagreement. I'm open to being wrong. I actually want to be wrong for as little time as possible. I want people to point out like where I'm missing things, and that's why I can't wait to speak to people who see gender in all types of different ways and unpack what they believe. But yeah, I think you're doing great work, Buck. And like I said, it was great to have those eye-opening moments listening to your content and going, wow, okay, I get it. There are some distinctions to be drawn here, and the clarity that comes from that. So one final question is, if people have got to this point in the conversation and they were to take away only one, or they were to have only one takeaway, what would that one takeaway be?
That gender dysphoria is real. That's what I want you to know. This is actually real. It's a real disorder. It's something that can take people out, and that I need my medication, and that we need to be able to access this medication. But what we need to understand, it's a very rare disorder. It's not what you see today. And so I don't want people to think that people like me don't exist, because we do. But it's a situation that is out of control. And many of the people who are transitioning are not trans. They're being duped into something. So I think that's the takeaway, is that we do exist and we are here, but it's a very small space, and it's not what you see today.
Beautiful, Buck. Thank you so much for your time, mate.
Thanks, friend.